Canadian troops don't have provincial health care cards. They cut them up when they join the forces. Their health care becomes the military's responsibility, and they see military doctors. But the Department of National Defence doesn't provide full-spectrum care. When more advanced procedures are needed, troops use the same hospitals and doctors as civilians, and the military reimburses the hospitals. But this spring, a major change. Multiple sources told Global News orders came from inside DND to cut healthcare spending. One of the first targets, fees charged by hospitals for seeing military patients. In a move that stunned the provinces across the country, the military quietly announced major cuts to what it will pay for hospital services without warning or consultation. Estimates obtained by Global News show drastic cuts to what the military will now cover. From paying $359 for an ER visit to $93.70, a decrease of almost 75%, and for day surgery, a drop of 96%. And the military will no longer pay for CT scans or MRIs that cost $700 to $800 each. Documents obtained by Global News show hospitals are anticipating a major shortfall as a result. An estimated $10.5 million in Ontario, and in Alberta, at least $2 million.
This will mean an increasing strain on their resources if they don't have the same financial amounts coming in, which will mean that they will likely have to cut back on some of the services that they offer.
Military sources privately told Global News that the healthcare budget has been ballooning for years, and they are under pressure to find savings. Defense analyst David Perry warns it could be a risky move.
Department of Defense that spent several years saying that their people are their priority. It's going to look bad if one of the areas where there's an effort to reduce spending is on the health side.
But some in the military healthcare system think the feds are being gouged by hospitals and insist the new rates are more fair. Alberta and Ontario disagree, saying the new rates do not accurately reflect the full cost of delivering health care to CAF members. DND acknowledged the cuts to Global News, but insists it's working actively with provincial and territorial governments and civilian hospitals with respect to the billing changes. The fear now that military members actively serving their country could be denied services or told to pay out of pocket. Two sources told Global News that one Ontario hospital is already refusing military members MRI slots, leaving troops in limbo in a battle they never signed up for. Stephenson, Global News, Mississauga.